Good morning, dear students. Myself Devraye-Patil, Assistant Professor and Head, Department of Chemistry, late Rameshwar Purkare ACS College Sonpet. Today we will discuss the very important topic, that is synthetic drugs. So, in the pandemic of COVID-19, we understand the importance of these drugs. So, the various definitions of these drugs are the chemical substances used to prevent or cure disease in human beings, a substance which used in prevention, diagnosis, treatment, or cure the disease in living things is called drugs. The chemical compound which destroy the disease called chemotherapy and given by Ehrlich in 1909. The systematic definition of drug is the use of drugs or chemical compounds to destroy infectious microorganisms, or they inhibit their growth without damaging host cells or tissues of human being or animals. Let we see the properties of good drugs. The action of drug must be on a disease affected site. That means the action is on specific. The action is specific. Be selective, less toxic to unaffected cells or tissue, and more toxic to diseased cells. They easily soluble in body fluid in our blood. Maintain a standard toxicity and not be made more or less potent by interaction with food or other drugs, or by conditions like other diseases, again which is easily available in market. Stable to maintain a constant therapeutic concentration in the blood or tissues, not generate resistance to its effects, again which have long lifespan. The drug must be minimum price, not allergic, and less side effects. Obviously, no such drug have all these properties. Any drug which can satisfy above 50% of a point, then we can say this is a good drug. Now we see the classifications of drugs, the class and are classified on the basis of their therapeutic actions. The functional drugs and chemotherapeutic agents. The functional drugs which stimulate or depress the function of body without, without destroying the disease. They do not attack on pathogenic microorganisms. They mainly used for non-infectious diseases to cure abnormal body functions like headache, uh, fever, etc. Chemotherapeutic agents. The drugs work by killing dividing cells. Ideally, it should attack microorganisms selectively and not harm human cells, for example, cancer cells, malaria, etc. Now we see the various uh, subcategories of functional drugs. That is, first one is the antidepressant drugs. This drug used treat to treat the depression and other conditions like anxiety, etc. Next one is the antipyretic drugs. This drug reduces the body fever. Antipyretics causes the hypothalamus to override an interleukin induced increase in temperature, for example, ibuprofen, paracetamol, etc. The next one is the analgesics. These analgesics reduce the pain, or again you can say these are painkillers, for example, nimesulide, paracetamol, aspirin, etc. The next one is the anesthetics. This drug causes total or partial loss of sensation with or without the loss of consciousness, especially tactile sensibility induced by diseases. Example is chloroform, nitrous oxide. These anesthetics used in number of before the number of operations, surgical operations. Next one is the anti-diabetic drugs. These drugs control the blood sugar level in the diabetes mellitus. The next is the anti-inflammatory drugs. This reduces the inflammation in the body. They shows analgesic property. They remedying pain by reducing inflammation which affect the central nervous system. Next one is the sedatives. They produce soothing, calming, and tranquilizing effects, reduces or relieving anxiety, stress, irritability, and excitement. Next one is the hypnotic drugs. These are psychoactive drugs whose primary function is to induce sleep and to be used in the treatment of insomnia. For example, benzodiazepine and heroin. Next one is the tranquilizers, which reduces anxiety, fear, tension, agitation, that and related states of mental disturbance. For example, phenothiazine and other. The next class is the chemotherapeutic agents. One is the antimalarial drugs, which used in treatment of malaria, which caused by parasite plasmodium. For example, chloroquine, larium, etc. The antibacterial drugs, they interfere the growth and reproduction of bacteria. They are found in products such as soaps, detergent, health and skincare products, household cleaners, etc. Triclosan, triclocarbon, and benzalkonium chlorides. Generally, we are now in this pandemic of COVID-19. We are very familiar to benzalkonium chloride. The next one is the antifungal agents. These agents selectively eliminates fungal pathogens from a host with minimum toxicity to the host. For example, fluconazole, itraconazole, ketoconazole, etc. Antitubercular agent. Any agent or a group of drugs used to treat tuberculosis. At least 2 or 3 drugs are used in various combinations in the tuberculosis therapy. For example, isoniazid, ethambutol, hydrochloride, streptomycin sulfate, and rifampicin. These are used in various combinations in the treatment of tuberculosis. The next one is the antibiotics. which are destroy or inhibit the growth of microorganisms used in treatment of external and internal infections. While some antibiotics are produced by microorganisms, most are now manufactured synthetically. For example, penicillin, streptomycin, etc. The next one is the disinfectant, a chemical substances used to destroy, neutralize, or inhibit the growth of disease carrying microorganisms, germs, bacteria, etc. For example, Dettol. The next is the antiviral drugs. They destroy, inhibit the growth of reproduction of viruses. For example, oseltamivir used in Tamiflu and zinamivir in Relenza. So, next is the therapeutic index. The therapeutic ratio, that is the comparison of amount of therapeutic agent that causes therapeutic effect to the amount of causes death or toxicity. Quantitatively, it is the ratio given by the lethal or toxic dose divided by the therapeutic dose. The ratio of quantity of the drug to kill the patient, maximum tolerated dose, that is MTD, to the required for a maximum curative dose, MCT, that is therapeutic index, is the MTD to the MCD. For example, therapeutic index of a drug is 10, means that 10 times a dose used for curative purpose would kill the patient as well as parasite. Thank you for watching this video. We studied this and assign the drugs used in COVID-19. Thank you.